Thank you so much for all of the feedback you gave me with my 5-minute artifact presentation. Here is my final presentation for Edit 8190, and I'm really excited that I was able to come up with an artifact that I think will be beneficial to our field and my research. Again, my name is Dave Trina Getson. Initially, I was thinking of SLP burnout and how SLP burnout contributed to quality of life and quality of life in professionals and students, as well as quality of life in clients and caregivers. And so I was playing around with this theme and knew that it had some relevance, but didn't necessarily tie into what I already had approved with an IRB and or any of the research or literature that I have already been submerged in. And so I was frustrated. I really wasn't sure what I needed to do, and I didn't want to do anything just to do it. I wanted to make sure that whatever I did was something that I would use. And so some of the artifact ideas that I initially presented looked at community resource literature. I was looking at a possible aphasia blog for speech language pathologists, and I was looking at how to prevent SLP burnout. The more I toyed with some of these ideas, and you could see my indecisiveness in my diary that I submitted, I became even more frustrated and felt exactly like this picture. And so I went back to the drawing board and really began to think about what was necessary, what was useful, and what problem I was seeing not only within the field, but here within the clinical realm at the University of Georgia. So I went back to quality of life and I put the clients back at the center. And I wanted to know from a professional and student clinician standpoint how um, how knowledgeable we were with quality of life. I wanted to know from a professional and student clinician standpoint how knowledgeable we were with skilled intervention and how skilled intervention played a role not only to our clients but within our clients' quality of life. And once I kind of got this concept down, I knew I was on the right track. I was excited. I knew that it tied into some of the literature that I was reading, but most importantly, I knew that there was a basis and a foundation for it with the study that I already have approved. And so I want to talk to you a little bit about the study that I already have approved and then present to you my Edit 8190 artifact. And so I have an IRB approved for an evaluating health related quality of life in people with aphasia. And basically what I'll be doing, this is just a additional side to let you know that it is definitely approved with my advisor, Dr. Rebecca Schisler Marshall. And basically what we'll be doing is collecting the data that's already being used in the clinic when people come in for assessments. And so what happens is someone comes in for an assessment and we look at their language, we look at their speech, we do some informal assessments. And so one of the things that I advocated for heavily when I started here was, why aren't we looking at their quality of life and what's going on with that as clinicians, to where we're just looking at language and cognition and how we need to use those things in treatment. And so this is just basically a little sample of what the protocol looks like and what we plan to do, which is just look at pre and post quality of life um, after they have received a semester of treatment. And the procedures involved will be just collecting the data. So the clients will be assessed prior to receiving semester treatment and then reassess after a semester of treatment. And I want to look at the relationship between language, communication, and self-perceived quality of life in these individuals. I am excited that I have an edit artifact that is a Qualtrics survey. And basically this Qualtrics survey will be for speech language pathologists and give me more information into what their views are on quality of life, if they're already assessing quality of life, in hopes to see what I'm seeing here at UGA, the pre and post assessments with treatment. I want to know what's going on across the board with speech language pathologists in assessing quality of life with treatment. And so now we're getting into screenshots of what my survey looks like. This is the first question. What is your primary setting of practice? And this information is useful because I want to see if there are any trends with speech language pathologists practicing in certain settings, if they more likely assess quality of life, and or what quality of life assessments are being used mostly within these settings. Here are questions 2 and 3, and I want to know how often are people using these assessments? How often are the speech language pathologists using these assessments? If you notice, there are already some answers here. These are my answers that I filled out as part of practicing with this survey. And so you can see that I use language assessments and quality of life assessment always, and then cognitive assessments and motor speech assessments sometimes. What quality of life assessments have I administered? Again, I've selected my importance assessments that I most likely administer when working with individuals. I wanted for 4 and 5, I wanted the speech language pathologists uh, to rank which order they give assessments, to rank which order they more preference, I'm sorry, with these assessments. And so I've ranked these according to my preference, which is the SQUAL 39, which coincides with what assessment I will be using this semester in the clinic, getting that pre and post data with. I also included an I don't use any quality of life assessments because I feel like that might be an answer. And if that is an answer, then that gives me more information. I wanted to get some free text, a subjective question in there. And so here I've asked, do you think quality of life is important to assess as part of treatment? And my response is yes, I think quality of life is important because communication and emotional challenges do contribute to rehabilitation. And so I'm really excited to see what information I get from my colleagues pertaining to this question, and see if there are any qualitative themes with it. Questions 6, 7, and 8. This is an 8-question survey. I wanted to know what additional resources or treatment material would best benefit people with aphasia. And if some of these responses look familiar, these are the responses that I initially toyed around with for my artifact. And so I kind of put them in here as part of the survey to see if anyone else thinks that they're a good idea. And if so, then I definitely plan to revisit that. And then I wanted to know how my colleagues were rating their own self-perception of quality of life. This kind of piggybacks off of the burnout question that I originally thought about. And so I wanted to know what we were rating our quality of life is, and if we even knew. And then lastly, do you believe that healthcare professionals should even assess quality of life? And I said healthcare professionals because this question I didn't want to just limit to speech language pathologists, but to the body, practicing body as whole, and see if I was the only one in this boat of thinking that quality of life was so important. Here is the link to my survey, just in case you guys want to look at it up close and personal, and or if you know any speech language pathologists that work in the medical setting that could use this survey, I would greatly appreciate you giving it to them. And thank you so much for your feedback. I look forward to what you guys have to say.